it's Faye and this is Day with Faye. Today is going to be a really special video because it's my first health video. Today we are going to be talking about moles, I know, a very sexy topic, and mole biopsies and what to look out for. As always, there are timestamps in the description below if there's a specific piece of information you're looking for. Now, as someone who has had pale skin her whole life, I've always been super hyper aware of wearing sunscreen, staying the same shade, before and after I go to the beach, all that jazz. Basically, I've had moles that have been there throughout my whole entire life as far as I can remember. Recently, I went to a dermatologist and I started feeling sensitivity in one mole that I have, which is under my right armpit, picture. And I went to the dermatologist, I explained my concern, and she immediately did a biopsy. What causes a mole? Now, apparently what I found out is that a mole is caused when there's a cluster of cells in one spot versus like it being spread out thoroughly, evenly throughout the skin. And that's what causes a mole. Now, moles can darken with exposure to sun, with being a teenager, and even being pregnant can darken your moles, which I thought was interesting. One thing that is really important if you have moles, and sometimes you don't know you have a mole, like I remember I went to the dermatologist 5 years ago. Apparently I have a mole on my back and I had no idea about it. So obviously I can't check my back by myself. So for some regions of your skin, you're gonna need a friend to help you out, a loved one, anyone. So most moles are not cancerous, but there are definitely signs to look for when you should go to a dermatologist. The ones that you want to look out for are moles that are different than the moles that you do have, or that change any of the ABCDEs, which we will go over soon. You definitely need to go to a dermatologist ASAP if your moles start bleeding, if they start oozing, if they start itching, or they become tender or painful. Now, if your moles stay pretty consistent throughout time, you really don't need to worry about it. So that's good. You can also get moles removed for cosmetic reasons. Now, for me specifically, I definitely did want to remove it for cosmetic reasons, but also because one time, a couple months ago, I actually got a piece of hair strand stuck to my mole and it wrapped around and it was so tight and oh god, it hurt so bad. And I spent like an hour with my fiance trying to get it out. I was like, I need to get this mole taken off immediately because I can't ever have this happen again. So it was always on my to-do list. But ever since that incident, it's always kind of been a little bit more tender for me. So that was another reason to get the mole removed. Now, I will caution that there's gonna be pictures of moles coming up, so if that makes you uncomfortable, please stop watching this video. Okay, so now we're gonna talk about the ABCDEs of moles. A, asymmetry. So that just means that one half of your mole does not match the other half. So look out for that. If it's asymmetrical, go to the dermatologist. B, border. The border of your mole is not smooth, it's ragged, blurred, anything like that. So again, if you find that problem, go to a dermatologist. C, color. The color is not consistent throughout your mole. Now, actually, the mole that I had under my armpit had that problem. Like, the left side was darker than the right side, so that was scary to me. So when I first got it checked out by a dermatologist years ago, they're like, oh no, you're fine. But definitely go get it checked out if that's the case. D, diameter. The diameter of your mole is bigger than an eraser on a pencil. If it's bigger than an eraser on a pencil, go to the dermatologist. E, evolution. This one's a huge one. If your mole starts changing its shape, its size, or its color, you know what I'm gonna say. Go to the dermatologist. Now, I don't know if this is common information, but if it isn't to you, just spread it out to your friends, because melanoma is the most common cancer in young women. And if by any chance this video helps someone identify melanoma before it's too late, great, that's awesome. I totally just want to spread useful information, especially with regards to health, especially because I feel like we live in a society where sun exposure is just so widespread. Everybody wants to go get tan. I remember in 2007 when I was in middle school, everybody was laying out, everybody was tanning, everyone had tanning oil on. I still see it today. but honestly, like, sun damage is so bad. It can cause skin cancer. It's really, really, really scary. It's just not worth it to me. Even though I got bullied about my paleness throughout middle school and made fun of in high school, and I still hear comments today when I go to the beach. People are like, obviously you don't go to the beach, and it's like, well, I do, but I just wear sunscreen because I don't want skin cancer, and I reapply my sunscreen that's above SPF 45 every 30 minutes. Like, I'm sorry. If you do feel the need that you need to be a darker shade, because I understand maybe it looks better to you, or maybe it just makes you happier, the best way to do that is spray tan. You can go to a person who is specialized for that, and I promise you, it does not sound as bad as you think. For example, the Kardashians, they get spray tans. And I know that when we think spray tans, we think super orange and super like bad. I really think that spray tan has kind of revolutionized over the time, and just when you go, don't try to get like 10 shades darker than you. Start conservatively and just see where it is, because honestly, your health is more important than a look. Sorry. So now I'm going to talk about my personal biopsy experience. I definitely had a crazy experience. So here we go. I go into the dermatologist to get a normal checkup, and I say, hey, I am interested in getting this mole removed. It kind of has pain for me, and also cosmetically, I just want it gone from my armpit. One thing that my dermatologist said was like, okay, we'll do that right now. And she didn't ask me if I took any pain relieving medication that day. I actually took a leave that morning because I was getting a migraine, so leave really helps with my migraines. And I didn't think I had to inform her about that. I took pain medication. She didn't know. She extracted the mole. They like numb you. They like give you some sort of numbing injection. I don't know. I wasn't looking because I hate looking at needles. It freaks me out. I didn't want to see her remove it. I just didn't want to watch it. It only like burned a little bit and stung for a little bit when the injection was put in my mole, but honestly it wasn't that bad, like at all. And I didn't feel the removal of my mole whatsoever. So she removed my mole and she bandaged me up, gave me my care card, which I will explain soon. And I left the building, and it was right next to this mall, so I was like, I'm just gonna go to Forever 21, hang out, and just shop. I have this gift card, might as well spend it. So I pick up these clothes. I'm starting to feel like the effects of the numbing shot or whatever wearing down. I'm starting to feel pain, but I'm like, it's okay, whatever, I'm good. I'm in the dressing room, take my hoodie off, and I notice that there's a crap ton of blood that just soaked through my hoodie. And I was like, oh, no. And then I lift up my armpit to see how it looks like. I was so terrified. I was like, why am I bleeding so much from a little tiny mole? And I freaked out. I'm like, oh my God, I'm gonna die. I just won't stop bleeding. Like, I kept feeling blood just coming out. It soaked through my bandage, just everything. I have a picture of it. And again, for people who don't like blood, like, just close your eyes for like 5 seconds, okay? I'm posting it right now. And I'll let you know when you can open your eyes. Okay, it's gone. You can open your eyes. That was scary. I was like, what is happening? I run back to the office. I'm like, I'm bleeding, blah, blah, blah. What's happening? She's like, oh my God, did you take pain relieving medication before this procedure? Yeah, I did. You didn't ask me. She's like, no, you can't take pain relieving medication when you have had a biopsy because it won't stop bleeding. You'll just keep bleeding, and the wound won't cauterize or whatever. She was like, I'm gonna try this specific ointment. Again, I'm not a dermatologist, so I don't really know exactly what it was. And she's like, if this doesn't work, I am going to like use some sort of zapping thing to zap it closed. And I was like, please don't use the zapping thing, please. So afterwards, I was fine. All right, so I'm gonna start talking to you about post-op. I don't know if you can call it a post-op if it was just a biopsy, but post-biopsy. Biopsy takes, at least the place that I went to, it took 2 business days to get. Thankfully, the results came back negative. I don't have cancer in this mole. Great. But self-care. It said don't make any like rigorous movements. Don't like sweat. Don't like expose it to sun. Don't be in a pool. Don't be in the ocean. Don't expose it to a lot of things. And think about your armpit is like, you move around a lot, so it just sucked. Like I had to like keep my arm like this for a good like week and a half. It was really tender and sore the first couple of days. I changed my Band-Aid twice a day, once in the morning and once again at night. I didn't put anything like Neosporin on it. I actually put Aquifer on it. Aquifer is amazing. So I would put Aquifer on it and then I would use Band-Aid. Band-Aids did not work on my armpit because obviously I'm sweating there. It's really difficult. What I ended up finding out that was the best for me was using gauze and medical tape. Now that helped the best. I would put gauze here, medical tape horizontally and then vertically. And sometimes it wouldn't fall off and other times it would. So anytime I left, I had a little baggie of medical tape, gauze, and some scissors to cut the medical tape just with me anytime I go, because I was told many times, don't expose your mole to the outside environment until the wound has healed. You don't want your wound to crust, you don't want it to do anything like that because that's when infection can happen. I got my mole removed 6 weeks ago and I kind of just wanted to show you the progress of how it looked like before and what it looks like today. So it's still not completely fully healed in terms of it doesn't look like this armpit yet. Eventually the redness is going to fade there, so that takes some time, but 6 weeks later, here's what the before of my armpit looks like. So there's definitely still some redness. I'm probably gonna have that for another month or two. That's just the progress. It's not gonna be like this immediately, so just to let you know. And yeah, so I hope that this was super informational for you. I know that this is not any of the other videos that I have out there. So anyways, yeah, make sure to subscribe if you haven't already. I try to post videos every Wednesday and Friday. I hope you have a good day, guys. Bye.